Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is hospital-acquired pneumonia. So this is the second in our series on pneumonia. Previously we discussed community-acquired pneumonia, and today we are discussing hospital-acquired pneumonia. Hospital-acquired pneumonias are defined as those which develop after 48 hours of hospital admission, and this includes nursing homes and care homes. It is thought to affect approximately 1 to 5% of all hospitalised patients. Common organisms which have been implicated in the development of hospital-acquired pneumonia, or a HAP, are Staphylococcus aureus, gram-negative bacteria including E. coli, Pseudomonas, Klebsiella, Serratia species, Acinetobacter, and Proteus. Anaerobes may also lead to HAPs, and it's important not to forget fungi, as well as strep pneumonia, which is less common, as well as COVID and influenza viruses. The symptoms to look out for in a hospital-acquired pneumonia, as many of you will know, particularly if you've done any part of acute medicine, would be reduced chest expansion, reduced breath sounds on the affected side, dullness to percussion, and coarse crackles on auscultation. And here on the chest x-ray, we have an example of someone with a right lower lobe pneumonia. It's very unlikely that you would get any form of pneumonia in your PACES exam, but it's good to know the signs and symptoms to give as a differential if need be, as well as when reading vignettes in the MCQ exams. As with anything in clinical medicine, a history and thorough examination are key. Particularly with a HAP, it's important to get an immediate set of observations, including temperature. In terms of further investigations, you would want to take a sputum sample and culture, as well as blood tests, including inflammatory markers and blood cultures. Urinary antigens should be done, as well as viral swabs, including COVID, flu, metapneumovirus, and RSV. A chest x-ray is, of course, also important. The management of a HAP involves inpatient intravenous treatment as per Trust formulary guidelines, usually with a broad-spectrum third-generation cephalosporin. Treatment duration is typically 7 to 10 days, but in high-risk patients, such as the elderly or the immunosuppressed, they may require a longer course of antibiotics. So now let's try a question. An 80-year-old lady who has been in hospital following a hip fracture is found to have a temperature of 39 degrees, respiratory rate of 30, and oxygen saturations of 90% on room air at a medical emergency call. She is 5 days post-op. A portable chest x-ray shows right-sided consolidative changes. Given the likely diagnosis, which of the following statements is incorrect? So our options are Staphylococcus aureus is a common causative organism. Intravenous antibiotics are indicated. Third-generation cephalosporins will usually provide sufficient antibiotic cover. Strep pneumonia is an uncommon cause. And CURB-65 scoring can be used for severity assessment. So the correct answer in this case is E, because CURB-65 scoring should be used for community-acquired pneumonias and not a hospital-acquired pneumonia, which is diagnosed based on signs and symptoms, as well as the fact that the patient has been in a care setting for over 48 hours. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.